because they say it's too much information here. But here's what I want to tell you, and here's what I want to underscore. The fibroblast is the godfather cell of wound healing. It's the main cell. And what happens here, we see that the fibroblast has many influences on submolecular mechanisms. And those influences happen by using cellular mediators called interleukins and cytokines. Specifically, IL-6, IL-8, and IL-10 are the most effective fibroblastic proliferating cellular mediators. So we see it's working on phase 2. We see that it's influential on the ECM, the extracellular matrix, which is the stromal aspect of the tissue, and also growth factors. But also, look, it's very influential on angiogenesis, on the development of angiogenic structures. Again, if we want to have tissue thrive, we have to give it a blood source. If we have a plant and we want the plant to grow, the same analogy, we have to water the plant. So, the fibroblasts, through fibroblastic growth factors, as well as endothelial-derived growth factors, will allow the tissue to proliferate, will allow the tissue to remain viable in the wound bed to make sure we have stromal integrity. This is critical. This is what we need to do and initiate these processes. And of course, we have protease release. So again, the relationship is very significant between fibroblasts and collagen. All right, another cell, the macrophage. Remember during phase 1, we have inflammation. Inflammation, we think injury. In injury, we have devitalized tissue. We have non-vital tissue. So through the process of phagocytosis and cellular migration, the macrophage is the garbage truck cell. It will engulf the devitalized tissue, cleaning that scaffolding and now allowing the fibroblast to come through. We see a lot of subcellular mechanisms here as well. Okay, so here's a problem that we face as clinicians. What's the differentiation between a chronic and an acute wound? By clinical definition, if an acute wound does not resolve in 6 weeks, we call it a chronic wound. Well, the chronicity of a wound is dependent upon several factors. A preponderance of exudation, number 1, which is very true. We also have a lot of bacterial bioburden in the wound. We see that there is a lack of chemical modulation in the wound bed. Also, there's a very deleterious protein called the MMP, the matrix metalloproteinase. So if we have an abundance of MMPs in the wound, we will assume that the wound is not going to heal. And I'm going to do a demonstration for you now. As Doctor had mentioned during the introduction, we have a product called gold dust. Dr. Saud, we used this gold dust on that patient in the ICU, right? We did that last time in my last visit. I have a glass of water here. We're going to assume this is a highly exudative chronic wound. And in order to initiate fibroblastic proliferation, we have to control the exudation. So I'm going to take the gold dust, which is 3 grams, in this sachet, and we're going to put it in here, and in about 1 minute, we are going to control the exudation. It will form a hydrogel, and the hydrogel is excellent for maintaining a moist wound environment so that we can now have fibroblastic proliferation. This is a great debrider. And look, we have no more water. So kindly feel it. This is non-toxic. It is a hydrophilic polymer that we developed in our laboratory. It absorbs 100 times its weight of exudation. So if you have a wound that's significantly exudative and you need to control it, that's something you should consider. Doctor, do we have some good success with that patient? We use it on that. That patient was comorbid, had significant medical problems. We're able to influence the change there. So this is how you have the opportunity to take a chronic wound, reducing the exudation. Now what that product does, it works via molecular capillary action. and the molecular capillary action will absorb all the bacterial bioburden, will absorb the exudation, and as well reduce any problem in the wound. Doctor, you used it in the diabetic foot clinic. Thumbs up, thumbs up.
Tell us about your experience.
Yes, please.
I think this is more than 4 months back. It's very good in enhancement of the region formation and fibroblasts also deal with transition of the celebration of the skin.
For
It's
diabetic
really good
patients.
for diabetic patients, yeah. For clean and for potentially clean wound.
Thank you for that, Doctor. In fact, Doctor had mentioned to our Representative Monley that it's like a miracle product. And I appreciate that comment. So we have taken the technology to manage every single type of wound etiology to come up with a solution. That's what we've done in our lab in the United States in our company. And that's the products that we have here for you. So, speaking of diabetes, we see that in every phase of wound healing, diabetes affects it significantly. Diabetes being a multisystemic issue, problems with the body producing collagen, and having a lot of metabolic issues, we see major deficits in every part of wound healing. So I'm just going to close with this. We see diabetic wounds very well healed, not only with the gold dust, but once you prepare the wound with the gold dust, you put in the collagen. We have a powder form of collagen, which is excellent for exudative wounds, and we have the gel form that's perfect for wounds that are on the dry side. This has collagen in a hydrogel, but also I put glycerin in here. Glycerin is a wonderful bacteriostatic and fungistatic agent. And we've used this in many different clinical etiologies, whether it's diabetic, venous stasis, arterial, skin tears, pressure ulcers. This is a patient I had. This was in Kuala Lumpur. I consulted at the hospital there. Stage 4 pressure ulcer, and they had the exposed coccygeal bone. Now, I put the gold dust in there. In 24 hours, that wound base was clean. Once the wound base is clean, I put the collagen. I took the gel and the powder in a medicine cup, made a paste, and I put it right in the wound. You know that we are growing tissue over exposed bone? And you say to yourself, how can that be? There's no blood source in exposed bone. Remember, the influence of the fibroblast is angiogenesis. So we are really having these products scientifically manufactured to influence the body to heal efficiently. Influencing the body. The body's in a great mechanism of a healing composition, but we're trying to make it more efficient in the healing process. So this patient was resolved in 3 weeks. 3 weeks. Surgical wounds, whether it's a dehiscence to the left, or if you have gaping areas on the line of closure, you take the gel, you sweep it right in there, you're sealing it, you're forming granulation, you are increasing the fibroblastic proliferation, and also you're reducing wound pain. I showed you the venous stasis and arterial insufficiency wounds. If you use the gel on those patients, you mitigate the pain because you're forming an occlusive dressing. As well, dermatologically and as an aesthetic benefit, you minimize the potential for scarring. As well for first and second degree burns, and the last slide I'm going to show is these are the replete benefits of collagen. Fibroblastic proliferation, chemotaxis, autolysis. I'm going to mention this because with the gold dust, you have to remove it from the wound. Remember, it's taking up exudation. But with the collagen, it stays in the wound. It's 100% biodegradable. So you don't want to wash the collagen out, because if you do, you're washing away granulation tissue. So we see that it's biodegradable, hemostatic, angiogenic. Remember that the major cell, the fibroblast, all the influences that it has, reduces wound pain, and very good for those chronic wounds that are recalcitrant and that are stalled. And you want to jumpstart that healing process, what you do is you use collagen. So I come back to the simplicity of using a wonderful molecule for every wound etiology, solving any problem that you can think of clinically, and it works, and it works. And I'm glad that we had some wonderful positive experiences with some of your patients in the hospital. I thank you so much for your time and your attention. It's been a pleasure. Any questions?